Hello. Today's topic is autism spectrum disorder, diagnosis, and ABA therapy. My name is Allie Gorup, and I am a board-certified behavior analyst at the Autism Care for Toddlers Clinic. I'm going to be presenting today, but there are many people who helped make today's presentation. There are faculty, staff, and students at the University of Nebraska Medical Center and the Munroe-Meyer Institute and the Integrated Center for Autism Spectrum Disorders. So what is autism spectrum disorder? Autism is a developmental disorder. The prevalence of autism is 1 in 44. So out of every 44 births, one individual is receiving an autism diagnosis. We know autism is 4 times more likely to occur in boys than it is in girls. The graphic on this slide depicts that. It is the prevalence of autism diagnoses estimates by sex. So you'll see that the boys are way above the girls in this graphic. Autism also occurs in all races, ethnicities, and social groups. So this graphic depicted on this slide is the prevalence of estimates of autism diagnoses by race and ethnicity. So to get into some facts and statistics about autism currently has no known cause. So we do know that there is some genetic and environmental interaction that increases the risk of autism, but we do not know what actually causes autism. There is no known cure for autism. So treatment helps decrease some symptoms of autism spectrum disorder, but does not cure an individual of having autism. What we do know for sure is that autism is not caused by vaccinations. Unfortunately, misinformation can be very harmful, and that was some misinformation that was spewed about and is still something that you can find on the internet nowadays, but there is absolutely no connection between autism and vaccines. So some of the primary characteristics of autism spectrum disorder are impairments in social interaction and communication skills, restrictive repetitive patterns of behavior, interests, or activities. The symptoms must be present early in the developmental period, and the symptoms must cause clinically significant impairments in functioning for that individual. So impairments in social interaction and communication skills can look like many different things. So that could be not picking up on nonverbal behaviors such as social cues, gestures, facial expressions, having trouble forming peer relationships, not spontaneously seeking out to share, interact with others, having trouble engaging in social emotional reciprocity. It could be a lack of spoken language or a lack of conversation skills. It could be not engaging in make-believe play or social imitative play, or it also could be stereotypical or repetitive use of language. So those impairments in social interaction and communication can affect each individual very differently, and it can look like a lot of different things. Same thing with the presence of restricted repetitive behaviors, patterns, or interests. So highly restricted, fixated patterns of interest could be, only wanting to talk about the same topic over and over again, or only being interested in one certain thing. Inflexible adherence to specific non-functional routines or rituals could look like, maybe having to do the same thing in the same order every time with no real function to that order, or lining things up in a certain way could be non-functional routines or rituals, or stereotypical or repetitive motor movements, use of objects, or speech. So that could be saying the same thing over and over again, maybe a movie quote or a line from a show. Repetitive motor movements could look like hand flapping or rocking back and forth. Or the repetitive use of objects could be, spinning a car wheel or twirling a pencil in between our fingers over and over again. Those are just some examples of what some of those repetitive motor movements or speech could look like. So what I do really want to drive home today is that everyone is an individual. If you have met one individual with autism, you have met one individual with autism. That is a quote that we love here because it's so true. Everybody has their own personality, their own, preferences, their own dislikes. And sometimes in this presentation, we're going to be talking more generally about things, but that in no way means that we're making generalizations about individuals with autism. And I want everyone to keep that in mind. Okay, so now we're going to be getting into some myths about autism spectrum disorder. So one myth that we already talked about is that vaccines cause autism. We know that this is 100% not true. We know that there's no known single cause of autism that has been identified right now. There is zero evidence to support a link between vaccines and autism. There is no scientific evidence to associate those two. And we do know that there are environmental and genetic factors that are associated with a higher risk of autism. But as I said before, there is no known single cause. But we do know that it is not vaccines that is causing autism. Another myth that is pretty common, and I feel like sometimes in the media and on TV shows and things, this is a way that some individuals on the spectrum are depicted. This myth is that everyone with autism is either nonverbal or a savant. Once again, very, very important for us to keep in mind that everybody is an individual. So autism affects each individual differently. Impairments can vary widely in terms of severity and impact. So for example, we were talking about impairments in communication skills. That could be impaired social communication. So having trouble engaging with other people. It could be deficits in receptive language, having trouble following instructions, or it could be, a lack of vocal speech. So that's just a small example of how some of these symptoms of autism can affect everybody very, very differently. And nobody fits into a little box or a label. Another myth is that people with autism always struggle to form relationships. I can speak to that firsthand just based off of working with a population of toddlers that have a diagnosis of autism. A lot of our kiddos at clinic have no trouble forming relationships and have very, very close bonds with the people that they're working with and with their peers. So even if an individual does have some deficits in social interactions, relationships can be formed still. And research shows that most people with autism want to form relationships and do not prefer social isolation. So just because an individual might have a harder time forming relationships or may lack some of the skills necessary to initiate those social interactions does not mean that they're not motivated to do so. It just might mean that they need a little bit more support and guidance in those social situations. Okay, now we're going to get into diagnosing autism spectrum disorder. So it's very important that to learn the early signs of autism and to act early. So early diagnosis, early intervention is key. Milestones do matter when we are looking at little ones' development to ensure that they're meeting the milestones that are developmentally appropriate. And if milestones are not being met, it's important that caregivers are contacting pediatricians or professionals to seek out opinions on what the next step should be if milestones are not being met. So the CDC has a free app that tracks milestones, which is really cool. You can download it to your phone and just track different milestones that kiddos are meeting and be able to see if there's any red flags or anything that would warrant a call to a doctor or another professional. So in Omaha, there are a few different places where one can receive an autism diagnosis. The Munroe-Meyer Institute is one, Children's Hospital is another one, and Boys Town Pediatrics is a third, just in the Omaha Metro. So their contact information is listed on this slide. So to give some insight to the diagnostic process, this is what Munroe-Meyer's diagnostic process looks like. Typically, it's a minimum of 2 appointments. The first appointment is used to gather important information and decide if further assessment is needed. And then the second appointment is to complete a comprehensive diagnostic assessment, gathering information about the child's symptoms, any behavioral concerns, and their skill level. These appointments often involve multiple different providers, so licensed psychologists, psychology interns, board-certified behavior analysts, and speech-language pathologists, just to name a few people that might be present. And typically it takes around 4 hours or so to complete. So there are many different assessments that are included in an autism evaluation process. So there's a clinical interview, and that might look like a semi-structured interview or unstructured observation of the child. Potentially might include screeners for the caregivers to fill out as well. There is a speech and language evaluation with a speech language pathologist. So this is looking at assessing speech, language, and any social skills. There's also a feeding interview that will be conducted, gathering information on current eating and drinking habits. And then an autism diagnostic observation schedule 2 or an ADOS-2 will be implemented for the use of evaluating possible signs of autism. After that is all complete, there will be a feedback session. During this feedback session, the professionals will review assessment results with the caregiver and see if they indicate an autism diagnosis. After that, recommendations and referrals will be made. So next, we're going to get into some different autism resources, some family support and community organizations that provide different resources to those who know an individual on the spectrum. And so there are many places where families can find information about autism and services. Listed below, there are some organizations, and they provide some information about education, early intervention, legal questions, and assistive technology, among other services. So we have the Munroe-Meyer Institute. The ACT and Action clinics are both part of Munroe-Meyer. Munroe-Meyer also has an early intervention clinic that serves individuals on the autism spectrum, providing ABA services, preschool programs, behavior clinics, and they have a variety of other services as well. There are parent resource coordinators that work at Munroe-Meyer who are available to assist caregivers and families in a variety of different ways. We also have the Autism Society of Nebraska. So the Autism Society provides a wealth of information about resources that can be found in Nebraska related to autism. There is the Autism Center of Nebraska. So the ACT clinic is actually located within the Autism Center of Nebraska. So they specialize in providing information about autism and have many different services and activities related for those that are on the spectrum and their families. Children's Respite Care Center provides care, programs, and services for individuals with special needs and their peers. And then there's the Assistive Technology Partnership, which provides individuals with disabilities assistance in gaining assistive technology. All right, this next page is a list of family resources and advocacy groups. So there's Parent Training and Information of Nebraska, so PTI of Nebraska. Their mission is to help children with disabilities be prepared to lead productive, independent adult lives. So their services include one-on-one support and assistance, workshops, and access to publications and websites, as well as caregiver support. Asking and answering any questions that caregivers may have related to their child. There's the Ollie Webb Center, which is a nonprofit organization committed to providing enriching opportunities for children, adolescents, and adults with developmental disabilities. They have support groups, sports teams, book clubs, social activities, visual performing arts, disability rights, and other services at the Ollie Webb Center. There's a Disability Rights of Nebraska. So this is a nonprofit protection and advocacy system for people with disabilities in Nebraska. And then we have the Nebraska Early Development Network. So this provides early intervention services for families with children ages birth to 3 with developmental delays or healthcare needs and connects families to needed services. All right, and next we have a list of different activities and sports that are available for those in the community that have an autism diagnosis. So being involved in sports and other activities builds communities and connections. There are many different places that offer different sensory-friendly experiences and activities to children and individuals on the autism spectrum. So there's a Special Olympics of Nebraska that is involved in different sports activities throughout the year. And within that, there's a Special Olympics Young Athletes. So that is more for younger children aged 2 to 7. Munroe-Meyer institutes recreational therapy. So they offer a variety of different camps and social opportunities for children, adolescents, and adults. There's Camp Munroe, which has lots of different fun activities, swimming, different arts and adaptive sport camps and other things. There are many local organizations with activities and events specific to the autism community. So Tennis Buddies, the Rose Theater, Henry Dorley Zoo, Omaha Children's Museum, a lot of times will put on activities or nights or events specific to those on the spectrum and their families to make things a little bit more friendly to those individuals. There's a CareMap app to help navigate your child's health, medical symptoms, and behavior to kind of stay on track and on top of those things. And then there's also the Autism Action Partnership. And so the Autism Action Partnership puts on lots of activities throughout the metro, activities and experiences that are specific to those on the spectrum and their families as well. Okay, so next we'll get into evidence-based treatment and talk about applied behavior analysis. So there are some scientifically validated treatment options for those individuals that do have an autism diagnosis. The most effective treatments for those with autism work to minimize the impact of the core features associated with deficits of autism and to maximize functional independence and the quality of life. So applied behavior analysis is one empirically supported treatment to decrease symptoms of autism. Under the big umbrella of ABA, there are different methods and ways of teaching. So we have early intensive behavioral intervention, pivotal response training, discrete trial teaching, the Lovaas model, and the Early Start Denver model. Speech therapy, occupational therapy, and physical therapy can all be therapies that also helps decrease those symptoms of autism as well and are scientifically validated treatment options. There are some treatment options that are not scientifically validated in regards to autism. And in fact, some of them can actually be quite dangerous. And so when thinking about the most effective interventions for an individual, we want to make sure that they're scientifically validated and also is safe. So some of these options are not very safe. Chelation therapy, hyperbaric oxygen chamber therapy, and holding therapy are all therapies that have unfortunately caused harm to some individuals, and those are not safe or scientifically validated treatment options to treat autism. Those treatments might be used for other things, but specific to autism, they are not scientifically validated. Gluten-free, casein-free diets and vitamin supplements. So it makes sense that if an individual has, nutritional deficits or has some sensitivities to certain foods or allergies to certain foods, absolutely, it definitely makes sense that if they are consuming those things that they have sensitivities or allergies to, that they're not going to feel the best. And when we're not feeling the best, we might act a little bit differently. But just strictly changing an individual's diet or adding vitamins does not specifically target their symptoms of autism. It might make them feel better. It might make that individual, have less stomach issues or whatever it may be, but specific to autism, they're not scientifically validated treatments to treat those symptoms of autism. And then we have like horse therapy, dolphin therapy, music therapy. Those are all awesome activities that some individuals might really, really enjoy, and that is great. We want people to be involved with activities that make them happy and that they enjoy. But horse therapy, dolphin therapy, and music therapy are not therapies specific to individuals with autism and don't specifically target symptoms related to autism. They might, they're great activities for individuals to be enrolled in, but as far as evidence-based treatments specific to autism, those are not included. So applied behavior analysis, or ABA, is a science that uses behavioral methods to measure behavior, teach functional skills, and evaluate progress. The main goals of ABA are to produce lasting and favorable change in behavior by modifying events that occur before and after behavior. The goal is to teach socially significant behavior to individuals that fosters safe and effective interactions with other people. Delivering effective services based on scientifically validated procedures. And then the big point of ABA is to identify the why. Why is the behavior happening, and teaching new skills and positive behaviors. So the best prognosis for a child with ASD is with early intensive ABA interventions. So it is recommended for maybe a younger child with autism that's just receiving their diagnosis, that they receive more intensive comprehensive services multiple hours per week. And then for maybe school-age children, adolescents, or adults, it is recommended that they have more focused treatment services that might be a little fewer hours per week. But once again, everybody is an individual, and it solely depends on the assessed needs of each individual. So these recommendations might not fit everybody. So what is ABA? In general, ABA is understanding why a behavior is occurring and applying interventions to change that behavior in order to help that individual function more successfully in society. So some of the focus areas of ABA are reducing challenging behavior, working on skill acquisition, working on language development, daily living and learning skills, and working on social skills. So to break down ABA and what it stands for, so the applied part is applying behaviors that help the individual function more successfully in their daily lives, things that are going to be socially significant to that individual, that they're going to use on a day-to-day basis. Behavior is any activity or movement demonstrated by an individual. So anything we're doing is a behavior. And the analysis part is analyzing and understanding why that behavior is occurring. So put that all together and we have ABA. So we have discussed what ABA is, but there are other important questions that we should answer as well when it comes to ABA. So why should ABA be used? We should use ABA to work with individuals that have that diagnosis of autism because it has been proven as a method to successfully help decrease those symptoms of autism. ABA was identified by the Surgeon General of the United States as the most effective treatment for autism, as well as it has been endorsed by the National Institutes of Health and Association for Science and Autism Research. So just saying, why should we use ABA? Because it works, because it's scientifically proven to help decrease some of those symptoms of autism and help individuals function more independently in society. Who benefits from ABA? Applied behavior analysis techniques are effective with everyone. So I think sometimes we think ABA is specific to individuals with autism, and although ABA is an effective treatment for individuals that are on the spectrum, ABA techniques are used all day, every day with all different populations. So it works for everyone. ABA techniques should be utilized all the time. So consistency is key when we're working with individuals. If there's different expectations in different environments or with different people, it can be really hard for an individual to learn what the actual expectations are. And so, it's super important that across all environments, across all caregivers or service providers, that everybody is on the same page and being consistent. Goes along with that too, ABA techniques should be used everywhere, at home, at school, in the community, at clinics, wherever that individual is going, we should be using our ABA techniques. So some important considerations when thinking about ABA. Behavior change does not occur overnight. So just because someone has been enrolled in services does not mean all of a sudden their behavior is going to be night and day. A lot of times undesirable behaviors often get worse before they improve. And so when we are working with little ones here at the ACT clinic, that is something that we talk to caregivers about a lot. Things are going to get worse before they get better, but as long as we're consistent and consistently applying our different interventions and ABA strategies, things will improve over time. Being consistent in applying interventions or recommendations is key. So once again, consistency is key. Another thing too that I want to point out is that it is always our job to find the right tools to teach and promote change in behaviors effectively. If an individual is not learning, if a little one at clinic is not learning, or what we are doing is not helping them out, it is on us to change what we are doing. It is never on them to learn in the way that we are teaching. It is always on us as service providers, as caregivers, to be the ones to change what we are doing in order to help effectively teach that individual. All right, what ABA is not. So ABA is not simply a reward or a sticker system. Although sometimes techniques such as token boards or sticker boards or reward systems are utilized within ABA, there is so much more to it. And ABA is not just giving kids rewards, a lot more than that. ABA is also not only for children with autism or developmental disabilities. Like I mentioned before, ABA techniques are things that we use all day, every day with every living being. And so it's not just specific to individuals that have special needs or developmental disabilities. ABA is not only about changing bad behavior or working on challenging behavior. A lot of time, the focus of ABA services is on skill acquisition and learning new behaviors, and not just focusing on decreasing challenging behaviors. And ABA is also not just an adult-driven model for changing behavior. ABA is a scientifically validated treatment that can be very, very beneficial to many different individuals. So here is a QR code that we have included. If you're interested, after you have watched this presentation, if you're interested in giving any feedback to us, we would really appreciate it. So you can open up your camera on your phone and scan the QR code, and it will bring up a link to give any feedback. And then we also have 2 additional QR codes for caregiver survey and community member survey. If you're interested in taking any of those surveys, once again, those are some QR codes there. Here is a list of some of the resources that were used for today's presentation. And I want to thank everybody for joining me. I really appreciate your time. And hope you have a good rest of your day. Thank you.